You're listening to the Doc Lounge podcast. This is a place for candid conversations with the healthcare industry's top physicians, executives, and thought leaders. This podcast is made possible by Pacific Companies, your trusted advisor in physician recruitment.
Hello, everyone, and welcome back to the Doc Lounge podcast. I'm Stacey Doyle, your host, and today we have an incredible guest joining us, Dr. Nikolov. Dr. Nikolov is a world-renowned, board-certified plastic surgeon with practices in both Beverly Hills and Madrid. Known for his artistic eye and subtle approach that enhances natural beauty, he has built a reputation for creating results that emphasize harmony and freshness rather than dramatic change. Over the past 2 decades, he has been featured on CNN, CBC, NBC, the Discovery Health Channel, and in countless publications, cementing his place as one of the leading voices in aesthetic medicine. Before opening his private practice, Dr. Nikolov trained at the University of Virginia and Duke University, followed by advanced fellowships in hand surgery and craniofacial surgery, even studying abroad in Taiwan. Today, he's on the staff at Cedars-Sinai and is a diplomat of the American Board of Plastic Surgery, as well as a member of multiple prestigious surgical societies. In addition to his surgical work, he also serves as the chief medical officer of CellSound, a groundbreaking non-invasive aesthetic treatment that's transforming the way we think about body contouring and facial rejuvenation. Unlike traditional procedures, CellSound uses advanced ultrasound and electronic sonic resonance technology to tighten skin, reduce inches, and rejuvenate cells, all with zero downtime and no damage to the body. So we're so excited to talk to you, Dr. Nikolov, today about your journey, your philosophy, and everything that's shaping plastic surgery and aesthetics today. So welcome.
Well, thank you for having me.
So I want to kick off because we have a lot of, potential, residents or potential medical students in our audience. Tell us, how did you end up in plastic surgery and going down that specialty route?
Well, it was a long journey. I finished training in general surgery. I was always fascinated by many subspecialties. I almost went into cardiovascular surgery because it's a field I loved. And when you're young, it's the place to be. It's a high. You get the adrenaline rushing. You're saving people. And it's exciting. Even now, sometimes talking about it, I kind of feel like I wish I could go to a case. But my other fascination was plastic surgery. And sometimes it's taken for granted, and people think, oh, this is the vain stuff and nobody cares. But I realized that you make just as much of a difference in one's life by reconstructing what has been damaged, whether in an accident, whether because of some kind of a disease, or maybe people that were born with some deformities. And also, it doesn't have to be a deformity. Maybe you were born with a bigger nose and it bothers you. Mm-hmm. And it bothers you to the point that it affects you socially, ends up affecting what you do in school, how well you perform, the jobs you look and apply for. It changes your life. And improving that one thing, you see one's personality change. Mm-hmm. I apologize.
Oh, no problem.
Allergies are not my friend, and they haven't been today.
It's that time of year.
So I realized that I can make as big of a difference in someone's life in plastic surgery as I really would in cardiovascular surgery. And it gets a lot more creative. There is a lot more variety. You work on the face, body, literally head to toe. So I decided plastic surgery is for me. And that's how the change came about.
I love that. Well, it sounds like you were going down one path and then you said, actually, this path might be better suited for me, and it has some creativity, pieces as well. So I'm assuming you then went through, did you do surgery first and then go into and specialize, or tell us a little bit about that path?
Well, after finishing general surgery, I went through full training in plastic surgery, which was an additional 3 years. So that's a total of 8 years of training after medical school. It's a long time, but to do things well, it's not time wasted.
And I'm sure that those are all that knowledge and all that expertise is your guiding principle today. So tell us a little bit about, how you approach your practice and, beauty in general, and how you decide, what that philosophy is when you're working with your patients.
Well, one of the things about plastic surgery, frankly, that I like, and it gets me excited, it's also the challenging part, is I get to be a doctor, so I have to make sure medically I do the right thing. I get to be a sculptor or an artist, hopefully not Picasso and his Cubist period. We don't want anybody too deconstructed there. So that's important. It's also important to get into people's heads. You have to be a psychologist. You have to understand the motivation, why they want to do something, what is really going to make them happy. And the first thing that a patient will say is not necessarily the motivation behind or the true result that they want to achieve. So you have to get into their head a bit, get to know them, understand them. They have to trust you to be able to share their true feelings. And that takes time and it takes a little work. And the last thing is you have to be able to technically do it. Because all that is great, but if you can't actually technically perform the procedure, it all is lost. So putting all these together gets me excited. And for me, it's the balance of all these that you can't let one fall behind. You can't ignore one aspect because you've lost the whole battle. Everything has to work and be optimized. My philosophy, keep it safe, and ultimately, I truly believe patients have their own beauty. Enhance their own beauty. Make them look good for who they are. But when somebody looks at you, say, hey, Jenny, you look fantastic. Not, oh, Jenny, you look just like Joanne over there. You want to be yourself. Just look fantastic. And for me, that's very important. Keep the person's identity, but bring out the best of them. We all have our beauty. We don't want to destroy that.
I love that. And it sounds like a very great approach. And I know that you've had a lot of success. I know you've been featured, on major networks and consulted by celebrities. So how do you kind of balance that high pressure, high profile, maybe clients, and then staying true to your philosophy as a physician?
I think patients make good decisions if you educate them, if you give them the proper tools, if they understand what is really behind that hyped up procedure that everybody's talking about, that's just the cute name behind it, but what is really being done? What is going to be the effect specifically on them? And even though it may sound cute, it may not be the right choice for them. Educating them to have an appreciation for why decisions are made. Most patients, not being doctors, they're very capable of making the right choice. And I don't have to push them to do anything. They will come to that conclusion on their own. But I think education is the key. And as a patient, if you don't know, how can you decide?
That's a great point. And I know that within your practice, you're dealing with, both plastic surgery and then non-invasive aesthetics. So how do you set realistic expectations with your patients?
Once again, you have to spend the time. And I spend more time with patients before the surgery than the actual length of the surgery. One of my other philosophies, I want you to look natural, I want you to look fantastic, but I want to get to that appearance in the easiest, simplest way possible. And easiest not for me, easiest for you. Less traumatic, less risk, less recovery. And if I have a way of getting there that I'm not going to prolong the recovery time, I'm not going to put you through unnecessary risk, why not try something that's easy and go directly to the big surgery? And I love surgery. Don't misunderstand me. I'm a surgeon. But if I have an easier solution, I'm the first one to suggest it, and I will jump up and down because I can give you something that it doesn't have to interfere with your life as much, and you can go back to work frequently the next day.
That sounds amazing. I mean, you've been practicing for over 2 decades. Tell us a little bit about the innovations and the advances in plastic surgery during that time and what makes you, most excited.
Well, I've been very fortunate, and I'll attribute more of that to luck than good foresight and a vision of the future at the time. But I was involved with radio frequency, a lot of the body tight, in-mode devices, face tight, uh, eventually what evolved into Morpheus 8 with radio frequency. They were groundbreaking at the time, and there's still devices that work well. But I've been able to ride that wave and be on the forefront of these new technologies that I can provide less invasive, minimally invasive surgery that can achieve what sometimes you need a major procedure for that cosmetic effect. And being exposed to all of these, searching constantly for what's out there, the new device now I've been associated with is non-focused ultrasound. And being unfocused, just for people to understand, the waves are not focused to a predetermined length. So it doesn't go at high intensity and kill every bit of tissue at that point where the focus is. This is non-focused. Unfocused waves are flowing down parallel and not causing any damage. It's low intensity. So we're moving away from creating even the minimal amount of trauma and still getting a healing effect. And I can go more into details when it comes to that. But the important part is up to now, pretty much everything we did is causing at least a micro injury. And by body healing itself, it caused the tightening effect. And whether it's laser, whether it's radio frequency, whether it's focused ultrasound, all of it created damage, and we could contour or we can tighten. With the new thing now that I'm really excited about, and that's the device from CellSound Aesthetics, we're able to treat the body where we improve the blood flow to the skin, to the deeper areas. We're able to improve lymphatic drainage. When you have improved blood flow, you have improved collagen formation. It improves cell division where it returns to a more youthful rate. So all the tissue is healthier. And whenever we want to, we can even contour, which means we can reduce the fat without killing any cells. And that, for me, it doesn't get any better. Well, I trained at Duke, so they'll say it don't get no better than that. So that, for me, is the holy grail. I can improve the health, and I can contour, and what more can you ask?
So this is what you're talking about. So this is from CellSound. And tell us a little bit about what are the effects that it could have, when you're treating somebody this way.
As I mentioned, pardon me.
Okay.
I get very excited when I start talking about CellSound. The effects, once again, is improves the microvasculature. The small vessels, the blood flow through them is greatly improved. And this device started as a wound healing device.
Oh,
people that had diabetic wounds that were stalled wounds that wouldn't heal for months or sometimes even a year or more, they were treated with this device. And after 10, 15 treatments, the wound will heal. And all of that has to do with improving the flow through the microvasculature and reducing the congestion in the lymphatics. As a result, you end up having a wound that's been open for a year and now finally it's closed, and it stays that way. So that was the original application. However, just like with everything else, if it makes the tissue healthier and it's in such challenging environment, why not also use it for aesthetics? Because we all want to look better and be healthier. And as you get older, whether you smoke or not, whether you're healthy or not, all of a sudden the tissue is not perfused as much. You're not getting the same amount of blood flow in the face, even the muscles, the deeper facial muscles, they tend to atrophy a little bit. They're not quite as plump when you look at them on imaging. And with this, we're able to deliver the type of blood flow we want, so we have a rejuvenative effect. And all of this, and the best part is, no, we don't cause any inflammation. And because we're not damaging anything, there's no pain during the treatment. Everything else that I know that makes you look better hurts.
This is true. This is very true. So, okay, so I'm assuming it does a lot of tightening. It can plump. Can it also get rid of, is it fat reduction? What else can it do?
One thing you mentioned is fat reduction. And of course, we all enjoy a good dinner and a good breakfast and a good lunch. And as a result, with a lot of work, we don't spend enough time at the gym, and we should. It's always good to be able to contour. And fat is frequently the one thing that we have to control or reshape to reshape the face, to reshape the body. With this, the important thing, and to understand how it works, you have the parallel, they're not focused, ultrasound waves going through the tissue. And if I may add, in the abdomen, the larger attachment, it penetrates up to 10 centimeters. So in the abdomen, that will go intra-abdominal. So these waves penetrate up to 10 centimeters in a parallel fashion. So it's at only, not to get technical, 2 watts per centimeter squared, which is a low intensity. No damage is done. So how does it work? The sound waves throw the cells in a hyperresonant state. And when that happens, they release the lipids into the bloodstream. So they shrink down, but they're not damaged in any way, or they don't die. They're still alive. Hormonally, that's important. Now, when the lipids go into the bloodstream, first reaction is, oh, it's just going to go someplace else. You've done nothing but just shifted it. Well, in reality, we have studies to show that, is that those lipids are used preferentially and at a much higher metabolic rate when an ultrasound treatment is done with CellSound. As a result, they're being used up. So the lipids in your bloodstream don't go up. They stay the same. They're just being used up as fuel, and the metabolic rate is increased. So it's not like you're just getting more calories floating around and you haven't won anything. That increased metabolic rate is also a key to reducing size without shifting from one side to the other. And the beauty of it is, again, there's no pain in the treatment, there's no downtime, and you're able to contour an area in a smooth way, at the same time not cause any damage whatsoever to the tissue.
It sounds too good to be true.
Well, it's funny you say that, because initially I was I was one of the very first adapters of the technology, but when they presented it to me, the person that came in, I knew well, I liked and I respected, but he came in with this and he's telling me exactly this thing, and my response was, I love you, but get out of here. Okay? I don't have time for this. Nothing is that good, and I don't want to hear about it. You know, I get it, whatever, that's your job, but there's no way this does all these things, because it sounded too good to be true. And it probably took him about a month for him to present all the studies and to convince me to look into it, because my response was, it's not possible something does all these things and fills in every box. But after looking into it, and I've been using it now for 3 years, I can say without hesitation, it does every one of those things. And we're finding different ways to utilize it, things that I don't want to even verbalize without having the proper data to back it up. But we constantly find new applications, and anything that improves blood flow and lymphatic drainage and without any damage, the imagination is the limit what you can do with it.
Yeah. Wow. Well, that is really incredible. And so tell us, if a physician wants to start utilizing this, that is, obviously within a plastic surgery, or I'm assuming even if you're a medical director running a med spa, is this available, or tell us a little bit more there?
This is a device that's available. See, every time I want to say CellSound, I get all excited. It's a device that's available for sale.
Okay.
There are plenty of devices, well, I shouldn't say plenty, but there are quite a few devices all over the country, but they're generally concentrated in more urban areas, bigger cities, Boston, New York City, Los Angeles, Dallas, Chicago. But it's available to anyone. You have to be a physician to purchase one, or if you're a med spa, that's available to a med spa. If it's a med spa, you have to have a medical director. State laws vary from state to state as to who can provide the treatment. In most states, you don't have to even be a nurse. You can be a medical assistant that is properly trained to utilize the device, and the company provides training. But some states, they may require that an RN, a registered nurse, performs the treatment. That varies from state to state, but again, requiring an RN license is the exception. It's a very safe device. You really have to try to screw up to cause a problem, and you have to try very hard. The difference is if you're properly trained, of course, you deliver a better outcome. The patients have better contouring, they have better perfusion, so the outcome is better, but it's safe that we don't worry as much about creating a problem because it's hard to do that.
Amazing, amazing. And I know you've been using it within your practice for, you said, for 3 years. So
Correct. Actually, just over 3 years now, almost 3.5.
Oh, wow. Well, that is amazing, and I'm glad that you're letting the physicians know, and then any person that obviously just wants to get this treatment, I'm assuming they can look up, kind of with that, looking at under CellSound, and then it's
The name of the company is CellSound Aesthetics, and the website is cellsoundaesthetics.com.
Great.
If you need any information, of course, people have my name. You can reach out to me, and I'm happy to provide you the information where you can look for further data, discuss with people what can be done and how can be done. But the website has quite a bit of the literature as well as pictures and a way to contact anyone to come and maybe perform a demo, whatever is necessary. I strongly believe if you're going to get something, you have to have the proper information. And although I believe in it, seeing is believing. And once you see a treatment, which actually is something else exciting, we have a camera that documents the results. It measures the change and measures the change in centimeters. So you can see a visible difference even after one treatment that can be measured. And it's standardized photography with different parts to it that you can cheat. And you will see a difference. And for me as a physician, I mean, before anything else, I have a practice. When a patient goes and has one treatment, they see the difference. I don't want to be a salesman. That's not my job. When they see the difference, I never have to talk them into having another one. I never have to say, look at this. No, I think you look a little better. They see it for themselves, and they go and sign up for the next treatment. And by the way, 6 treatments usually, 2 treatments a week for 3 weeks. So they just sign up for the next one. I don't believe in packages. Seeing is believing, and once they see it, we never have a discussion again. And I like that.
That I'm sure that makes your life and your practice easier. Yeah, the results speak for themselves. So once someone utilizes it once, they come back for more, which I think is really, really speaks to the treatment itself. So I'd love to hear, as we're closing up, where do you see the future of aesthetics going in the next 5 to 10 years? I mean, you're definitely on the forefront of things. So let our fellow physicians or anyone that may be interested in going into plastic surgery, where do you think things are headed?
A lot of plastic surgery, at least the aesthetic part of plastic surgery, has to do with having a vision, educating patients, knowing the path that they need to take, not just short term, but long term, not just doing one procedure, but sort of planning ahead what they may need 10, 15 years later, and all of it to make sense. utilizing new technologies, it makes us look better as plastic surgeons. Again, I mentioned one, which is CellSound. And the one thing I didn't mention is I also use it a lot before and after surgery to enhance the effects. And not just did I leave some fat behind, but reduce swelling. I use it after facelifts. Patients heal faster. But utilizing these new technologies makes us look better, and more importantly, makes the patients heal better. So new technology is great. This is a total shift from everything we know in energy devices. But there'll be other things coming. And the idea is embrace what's out there. However, just as a warning, there are a lot of technologies, just a new shiny box and it's the same old thing. It does not mean that just because the box is shinier, it performs any better. And sometimes it's just a different version of the same old thing. Look at what the nature of technology, how it's applied, and understand how it works, not just looking at, oh, I think this is better, so patients will like it. It's a waste of time and money. But there are new things coming out, and embracing technology enhances what we do. Nobody's going to replace the artistry. And again, that's maybe sometimes overemphasized, but that understanding vision of what someone can look like and the harmony you're trying to achieve, and knowing how you can get there so the patient is most comfortable. But I'm excited about everything that's coming out, and I can't wait to see what the future holds.
Well, thank you so much, Dr. Nikolov, for really just sharing, everything that you did with us today about your insights into the art and science of aesthetics, and really about the exciting future of treatments with CellSound. And it just sounds like such a great, technology. Now, tell everyone that's listening how, if they are interested in, seeing you at your practices, how can they do that? What is the best place for them to go?
My website is drnikolov.com, doctor being abbreviated, drnikolov.com. They can also call my office, 310-247-1932. I'm in Beverly Hills, California, easily found. Google is very good at that. And if they need information about CellSound, CellSoundAesthetics.com. There's plenty of information, but if somebody's interested in that, whether as a patient or an end user, please give me a call. I'm happy to at least direct you in to the proper people that can deal with that, and I'm happy to help out.
Well, thank you so much. It's been a fascinating conversation. And to all of our listeners, thank you for tuning in. Don't forget to subscribe to the Doc Lounge podcast so you don't miss an episode. Thank you so much, Dr. Nikolov.
Thank you for having me.
Thank you to all of our listeners. If you would like to be notified when new episodes air, make sure to hit that subscribe button. And a big thank you to Pacific Companies. Without you guys, this podcast would not be possible. If you would like to be a guest, please go to www.pacificcompanies.com. Thank you.